people use the words dementia and Alzheimer's like they mean the same thing. They don't. And that confusion creates a lot of unnecessary fear because someone forgets something and suddenly the question becomes, is this Alzheimer's? I'm Dr. Paskey. I'm a neurologist and I spent years taking care of patients with memory disorders, including Alzheimer's disease. So in this video, I'm going to be walking you through this very clearly. What dementia actually means and what Alzheimer's actually is, what early signs matter and what don't, and most importantly, what to do if you are worried. Let's start with the most important idea. Dementia is not one disease, it's a category, a pattern of decline in thinking that affects daily life. Alzheimer's is a disease, and it is the most common cause of dementia in the world. So think of it like this. Dementia is that umbrella that covers Alzheimer's and many other dementias. So is it just aging or is it something more? That's the real question people care about because everyone forgets things. I don't remember what I had for dinner on Sunday evening. So forgetting things alone is not dementia. What matters is the pattern. Are things happening more often? Are they getting worse? And most importantly, is it affecting real life? So, for example, they keep repeating the same question within minutes. They get lost somewhere very familiar. Trouble managing bills and medications. Forgetting recent conversations consistently. That's different. Because now we are talking about function, not just memory. You see the difference? But why is memory so important and talked about in Alzheimer's? Because recent memory is usually affected more than remote memory. That's why that repetition is often the first thing that families notice. And here is a key idea. There is a difference between storing information into a brain that has no disruption in its architecture and creating new memories in a brain that actually has Alzheimer's. So older memories may still be there, but the new ones don't stick the same way. That's why you might have someone tell you a story from 20 years ago. They sing the song that was played on their wedding day, but forget what happened this very morning. So, what's actually happening in the brain? At a molecular level, Alzheimer's involves changes in how neurons communicate with each other. You hear those terms like amyloid, tau. But the important part is communication between brain cells become less efficient over time. And that disruption affects thinking, it affects memory and function. But it is usually gradual, which is why it can be easy to miss it early on, especially in patients that are highly educated, highly functional. So, what does early Alzheimer's look like? Early Alzheimer's usually does not look dramatic at all. It is subtle but persistent. Repeating questions, forgetting recent events, relying more on notes, but still missing things. Trouble with planning and organization, small mistakes with finances and medications in someone that was always so meticulous. Sometimes word finding difficulties, sometimes judgment changes. And often families notice before the patient does. So, when is all this not Alzheimer's? This part is also really important. Not every memory problem is Alzheimer's. There are many other causes: poor sleep, depression, anxiety, the start of a new medication, just plain old stress, medical issues like thyroid problems, or even vitamin deficiencies. Sometimes the issue isn't memory at all. Again, it is attention. So, if something wasn't fully processed in the first place, it cannot be remembered later. That attention is not there when the information is coming in. And that's where Alzheimer's really disrupts the functioning of the brain. So, a memory complaint in its own is not everything, but it deserves attention. Also, it does not equal an Alzheimer's diagnosis. Dementia is not just memory. Let's clear this misconception because dementia can affect planning, language, judgment, spatial awareness, that is, navigation, behavior, and more. That pattern matters because that is what helps us understand the cause and differentiate this from other conditions that are way treatable. So, what do we doctors do when someone comes in with concerns and they are telling us they are forgetful? We begin to look for patterns. No one patient is the same. And this is where I tell students diseases do not read the textbooks you're obsessing with. You need to look for patterns, the timeline, the daily function, other symptoms, medical history. And often the input from the family is the most important. But we still need to assess cognition. And sometimes we need blood tests. We need imaging to rule out other causes like strokes, brain tumors. There isn't just one single test that will give us the answer instantly. It's a combination of information. So, what should you do if you are worried? If you are concerned, don't panic. Stay calm, look for patterns, write down specific examples, and get an evaluation if things are progressing or affecting daily life. Because clarity is better than guessing. A diagnosis of dementia is not one that we give very easily. We need to be sure because it can close the door to other treatments. If you can take one thing from this is dementia is the umbrella. Alzheimer's is the most common cause. Not all memory problems are Alzheimer's. And concern should lead to evaluation, not fear, not guessing. But understanding this clearly takes a lot of unnecessary anxiety and fear away from this process. If you have any burning questions about a diagnosis a family member has or a topic you would like to hear about, leave them in the comments. And welcome to NeuroInterpret, where I demystify neurology, make it more understandable because I firmly believe that understanding a disease is the first step in dealing with it, curing it, or living with it, like in the case of Alzheimer's. See you next week.